This presentation covers your DriveTime Benefits Open Enrollment for 2018. If you have any questions regarding the information provided in this presentation, please contact the Benefits Call Center at 855-430-4558. You can also contact the DriveTime Benefits team at 888-781-5654, option 1. Let's get started. First, let's look briefly at what open enrollment is and when open enrollment is. What it is a 2-week period of time beginning on October 2nd through October 13th when you can go in and make changes to your existing benefit coverage. You can add coverage, drop coverage, add a dependent, drop a dependent, whatever you'd like to do in way of changes for whatever reason. Normally, you can only do this as a new hire or when you have a life status change, which is a qualifying event. An example of a life status change might be that you get married, you get divorced, you have a baby, or that your spouse loses or gains coverage elsewhere. But with open enrollment, you can do this for any reason at all. As for when it is, it's that 2-week period beginning on October 2nd through October 13th. The benefits that you elect during open enrollment will become effective on January 1st, 2018, and will be in effect for all of 2018. Some important things to remember about open enrollment and the period of time when you go in to make these changes. Flexible spending accounts, also known as FSA, and health savings account, also known as HSA, you will have to go in if you would want these deductions to occur in 2018, and you will need to re-elect them. Now, normally we have what we call a passive enrollment, where you don't have to go in and make any confirmations if you're not making any changes. However, for 2018, we have a number of changes, including additional dental options, additional vision options, and voluntary benefits being introduced new in 2018. We also have some planned rate changes, including an increase in one rate and a decrease in 2 other rates. Because of all these changes, we are requiring that you go in and confirm your elections. When you go into the system, if you will see your existing benefit elections in the system. If you don't want to make any changes, you can simply confirm them. If not, you will need to add any new coverage that you'd like to have for 2018. I had mentioned that we have one rate increase. That is going to be for the medical plan, for the traditional plan only. Now, we haven't had any changes in the rates for the gold and silver tier for 10 years. So for 2018, we are having an increase in the medical plan rate. As you can see here, the traditional plan, an example would be for the gold tier. That's the highest tier. The best discount for employee-only level coverage would be $31.90 per pay period, compared to the 2017 rate of $29 per pay period. For the individual level of coverage and wellness tier that you're in, you can find the information on this presentation here. Liberty plan rates are not changing for 2018. Our medical plans remain unchanged for 2018, meaning we will still use United Healthcare as a carrier for the 2 plans, and the 2 plans that we offer are still going to be the traditional plan, which is a preferred provider organization, PPO plan, and the Liberty plan, a high deductible health plan. The only difference you'll see is the premium per pay period for the traditional plan will increase, and the deductibles for both plans will increase as well. And we'll look at those deductibles in just a moment. But first, we'd like to make sure that you're clear on the difference between the 2 plans, just in case you're considering making a change. First, we'll look at the Liberty plan. That's a high deductible health plan. The way this plan works is you have to meet a deductible out of your pocket before the plan pays for anything. That deductible would be $1,350 for individual level coverage or $2,700 for family coverage for 2018. After you meet this out-of-pocket deductible, the plan will pay 80% and you will pay 20% for in-network services. After you there's an out-of-pocket max as well. And so after you meet the out-of-pocket max of $2,600 for individual level coverage or $5,200 for family level coverage, then you won't have to pay for anything else for the rest of the year. Now, an exception to meeting this deductible before the plan pays for anything would be that you get 2 free physicals per calendar year. So you don't have to meet the deductible to get those physicals. And you can get maintenance drugs at no cost to you without meeting the deductible. And in case you're wondering what is qualified as a maintenance drug, that is something that the federal government determines. And examples of that would be diabetes medication, blood pressure, cholesterol, even birth control medications would be considered maintenance drugs. And as long as that maintenance drug is on our prescription drug list, which can be found out on our DriveTimeBenefits.com website, then it would be at no cost to you. Unfortunately, there are some drugs that are not considered maintenance drugs by the federal government, and an example of that would be antidepressant. For a full list of what drugs would be covered, you can go to the United Healthcare website at myuhc.com. Now, if you're wondering why would you choose a high deductible health plan like this where you have to pay more money out of your pocket before the plan pays for anything, one answer would be because you pay less per pay period to have the Liberty plan than you do to have the traditional plan. Another reason why you might want to do that is because if you're not seeing the doctor a lot other than that once per year physical, and any drugs, prescription drugs that you may get, if they are on that maintenance drug list, then your likelihood of having to meet that deductible out of pocket is pretty low. So this might be a good plan for you. But if you do decide to go with this plan, you should probably plan ahead and for the possibility that you might at some point have to meet that deductible. And that's where a health savings plan comes into play. A health savings plan is where you are able to take money out of your paycheck each pay period and put it into an account that's held by a third party, Optum. And this money comes out of your check pre-tax, so you save on the amount of income tax that comes out of your check each pay period. When you contribute to this plan, your employer will match on up to $250 per year of what you put in for an individual plan, or up to $500 for a family plan. Now, the government does have limits of what you can contribute per year. It's $3,450 for individual level coverage or $6,900 for family coverage. And these limitations are including the amount that your employer is going to contribute. One good thing about this HSA plan is that it rolls over from year to year, which means you're able to build a nest egg over time in order to meet that deductible should you need to do that. So it might be a good plan for you to consider. Now let's look at, and I should also mention, if you were to leave the company, that health savings account, it goes with you, including the amount that your employer put in. So now let's look at the traditional plan. The way this plan works, it also has a deductible of $850, which is lower than what you saw on the other plan, and $1,700 for family. However, if you need to use the coverage on this plan, the only time that deductible is going to apply is if you need to have like a procedure done or you need to go to the hospital, things like that. Because if you want to go just to your primary care doctor, you pay a $30 copay. If you want to go to a specialist, you pay a $50 copay. If you want to go to urgent care, you pay a $75 copay. And to go to the emergency room, you would pay a $250 copay for the first 2 visits in a calendar year, and then it scales up from there. This plan also has an out-of-pocket maximum. It's $3,750 for individual level coverage and $7,500 for family level coverage. So this plan works a little bit differently from the other plan. However, it also has a spending account that could go with it. Like the health savings account goes with the Liberty plan, you could have a flexible spending account, commonly referred to as FSA, that you could partner with this account that help you meet that deductible. The maximum contribution to a FSA in 2018 is set by the government, and it would be $2,600. Some important notes that are distinctions between this and the health savings account is this account does not roll over from year to year. So you have to make sure that whatever you're electing is the amount that you plan to use for the year, because if you don't use it, you would lose it. Your employer also does not match on this for this plan, so that's another important distinction to know. And if you were to leave the company, the money does not go with you. But one important difference that is a benefit to you for this plan is that the entire amount that you elect for the year is available to you on January 1st. So let's say you decided you wanted to do $1,000 and that your deductions are spread out over the 26 pay periods throughout the year. However, that entire $1,000 is available to you on January 1st. And if you were to use it and had not yet paid back the money to the company and you parted ways with the company, you would not have to pay that back. So it's just an important feature to remember about this plan. We want to make sure that you're aware of Teladoc. It's our telemedicine offering, and if you have our medical coverage, we encourage you to give Teladoc a try. What Teladoc does is it partners with your primary care doctor. So it's important to note this is not meant to replace your primary care doctor. This is more of a service that is meant to be available to you when you aren't able to get in to see your regular primary care doctor. For example, if you had an ear infection or your child had an ear infection in the middle of the night and it's 3 o'clock in the morning, and what are your options? Well, you can go to urgent care if you can find one that's open, or you can go to the emergency room and pay a whole lot of money. But with this service, you don't pay for anything. The company pays for it. You call them, you explain to the doctor what your symptoms are or what your child's symptoms are. Your family members are eligible for this. And if a prescription is necessary, they're going to call one in over the phone. So the convenience of this is you're calling from the convenience of your home, and you can go to a 24-hour Walgreens or wherever you'd like them to call in a prescription, and you're not sitting in an emergency room and you're not paying a lot of money. So that is a great opportunity to avoid all of that cost and inconvenience. And if you do choose to use Teladoc, I would encourage you to register ahead of time, because you're not going to want to do that when you're feeling sick. Now, let's talk about dependent verification. Open enrollment is also that opportunity for you to add dependents to your coverage without having a life status change. So this is where you can add a spouse, your biological children, stepchildren, or adopted children. Unfortunately, you're not going to be able to add other family members or individuals such as grandchildren, parents, grandparents, any other family members. It's pretty much what you're seeing listed here. If you do choose to add additional dependents during open enrollment, please keep in mind you are going to have to provide proof of relationship to these people. So for your spouse, for example, it would be your marriage license. For your biological or stepchildren, it would be a birth certificate. And for adopted children, it would be the adoption paperwork. And you're going to need to send that information to mydtbenefits.com. Now, your adult children can be on your medical coverage until their 26th birthday, so you may want to make note of that. They do not have to be a full-time student to be on your medical coverage to that point. And they can be on your dental and on your vision until their 25th birthday, but they do have to be a full-time student to be on your dental and vision, and you will have to provide proof that they are enrolled. If you have children already on our plan, you do not have to provide information to keep their medical coverage intact year after year. Once you've provided that once, you don't have to keep providing it.
The Premium Provider Network is a service offered by UnitedHealthcare, which helps to identify doctors and facilities that have been proven to provide a higher quality of care. These have been based on metrics that are national standards, and this is something that UnitedHealthcare has actually offered for quite a while, but it's something that we're going to be promoting going forward, because we actually feel that this is something really useful for our employees, as it helps to promote better outcomes. One of the things that is going to be available through using the Premium Provider Network is reduced copays in 2018. So if you're going to go to a primary care physician, instead of the $30 copay, you would pay $20. And for a specialist, instead of the $50 copay, you would pay $40. In order to identify these doctors, you would go out to the MyUHC website, which is www.myuhc.com. You could also find them on the app, but when you look up a doctor in your area, you will see them identified by these two hearts, these two blue hearts where it says Premium Care Physician, and that's how you know that these doctors are part of that network. So we're really encouraging you to go out there and try to find these doctors and use them going forward. Surgery Plus is a new offering for 2018. It's a company that actually helps you find board-certified surgeons with an extensive history of quality, and it helps you save money on scheduled surgeries. The way it does this is by bypassing the insurance companies, and you as a patient work directly with Surgery Plus rather than having to go through the insurance company to get these scheduled surgeries. Something, for example, like a knee replacement, or if you had to have foot surgery, those kinds of things would be what Surgery Plus would help you with. If there are no surgery centers in your area, they'll actually help you plan and pay for your travel. And one of the nice things about Surgery Plus is that they will actually be waiving deductibles, coinsurance, and copays if you're on the traditional plan. And if you're on the Liberty plan, they would actually give you an HSA contribution up to $700 since they can't waive the deductible, but they would be able to waive the coinsurance. If you want more information about Surgery Plus, you can visit their website at www.mysurgeryplus.com, and there will be more information on our website, DriveTimeBenefits.com, starting in December. DriveTime's wellness plan is something that we're very proud of, and it's something that we want to encourage you to be a part of. For 2018, the biometric testing and annual physical will be required in order to achieve gold and silver rates. That means even if you earn enough points to get out of the bronze tier, if you have not completed your biometrics and physical, you will not be able to get into gold and silver. The wellness steps for 2018 to lock in your tier are due on November 30th, 2017. So keep in mind any points that you earn between now and then will get you to your tier as of 1/1/2018. If you've already completed your steps in 2017 and you're already in the gold tier, you are good for 2018. Also keep in mind if your spouse is on our coverage, he or she also needs to do the biometric testing and annual physical. Your ultimate tier will be based on the lower of the two. So if one of you is in gold and the other is in bronze, you will be in bronze. Let's talk a little bit now about the wellness tiers. In order to achieve gold, you do need to earn at least 3,000 points. We have a platinum level as well. If you earn 3,500 points, you could be in platinum. It doesn't give you any additional discounts, but you can earn a $50 Amazon gift code. Keep in mind, for employee-only coverage, in 2018, the difference between gold and bronze is $59.40 a pay period. That's a total of $1,544 different per year. It's a huge amount of money, so we just want to remind you that with all of the options available, there's no reason for anyone to be in bronze. So how do you earn those points to get into that gold wellness tier? Well, the first thing you're going to do is print out the form that you need to take to your doctor. You're going to go to www.drivetime.mywellmetrics.com. You can also link to the site through the DriveTime Benefits website, and that's going to take you to Aduro. Aduro is our third-party wellness vendor. On top of calculating all of the points and having the forms out there for you, they also have wellness challenges that we'll talk about in a little bit. But let's talk about the form first. So you're going to print out this form, and at the top is the non-tobacco user affidavit. If you are a non-tobacco user and you sign that, you will get 600 points. Then you'll get an additional 1,200 points for taking the form to your doctor and having them fill it out and send it in. So regardless of the outcome of your biometric testing, you will earn 1,800 points just for completing those steps. So how do you get the points for your biometrics? Well, you can see here we have 4 different biometrics that we test. Your blood sugar or A1C, your BMI, your cholesterol, and your blood pressure. The blood sugar and cholesterol are done via a blood test, and your doctor will complete the other 2 when you go to the visit. For each of these wellness biometrics, we have set the values you can see here, and they are set to be borderline values, which means even if you are concerned that your numbers might be a little high, you could still earn the 300 points for getting that value because we have set them to be those borderline values. So let's talk about what happens if you don't earn those points. If you get the 300 points for all of those biometrics and you add that to the fact that you've done your physical and your testing, you would get your 3,000 points and you would be in gold. But if you don't meet one or all of those values, there is the option to have a wellness appeals form completed. So you or your spouse could have your doctor fill out the form, which you will also get on the drivetime.mywellmetrics.com website. You'll take the form to your doctor and he would sign off on one or more of the values that you don't meet. So for example, if you have a medical reason for not being able to meet one or more of the requirements, like for example, if you're pregnant, your BMI might be higher than the value that we've set. In that case, your doctor could sign off on that wellness form and you would still get the 300 points. Or perhaps you're working with your doctor to manage the condition. So if you are on medication to control high blood pressure or cholesterol, your doctor can also sign off on that to give you those 300 points. If none of these options gives you the points that you're looking for and you still need to earn more points to get into a higher tier, then you can go back out to the Aduro website and review their wellness challenges that they put out there. They have all different kinds of health challenges, food challenges, even sleeping challenges. You can get points for going to the eye doctor for a screening, to go to the dentist. So there are a multitude of ways to earn those points for the wellness program and get into gold or silver. In 2018, we will be continuing our dental coverage with MetLife. We are actually going to be offering a third plan on top of the two that we currently have, and the premiums for the standard plan and the enhanced plan, formerly the low and the high, will be decreasing in 2018. So for example, for family coverage on the standard plan, the per pay period amount is being reduced by $1.08. Keep in mind that MetLife does not issue ID cards, so once you do sign up for that dental coverage, if you're waiting for one to come in the mail, it won't. So make sure you go out to their website and print one out if you do want that card. Otherwise, you just need to provide your dentist with our group number, which can be found on the benefits website, and your social security number. So let's talk a little bit about the difference between the standard or formerly low plan and the enhanced or formerly high plan. For the standard plan, you will see there's different coverages if you go to a doctor out of network, where you pay more out of pocket. So the best thing for you if you have a dentist that you really like but they're out of network is to go with the enhanced plan. If your dentist is in network, choose the standard plan because that's going to give you the better coverage. One of the things it's going to offer you is orthodontia coverage for child only, and that is up 50% up to a $1,500 lifetime max for each covered individual. The annual plan maximum for the standard plan is going to be $1,500. Now let's take a look at the enhanced plan. So the enhanced plan is going to give you the same coverage whether you go in or out of network. So again, if you have an out-of-network dentist, this is likely the plan that you would want to choose. It's going to have the same annual plan maximum as the standard plan, $1,500, but this one actually offers an additional benefit of adult orthodontia coverage for the same lifetime plan maximum, 50% up to $1,500. So now let's look at our new Premier plan and see the new benefits that will be offered with this. So for a little bit more money out of your paycheck each pay period, you're going to get a much richer benefit. For example, for preventive care, you get 4 cleanings per calendar year, 100% covered, as opposed to 2 on the other plans. Additionally, you could also get composite fillings or tooth colored on all teeth, as opposed to just composite in the front and silver in the back. This plan also offers the same orthodontia coverage for adult and child up to $1,500, but this plan has an annual maximum of $5,000. So if you are somebody who needs a lot of dental care, this plan would be the one for you.
We are using the same carrier provider for vision as we have in years past, VSP. Just like with MetLife, our dental coverage provider, VSP does not send out coverage ID cards. All you need is the group number, which can be found on the DriveTimeBenefits.com website, and your social security number. New this year is a second plan option. In years past, we have offered just one plan for vision. What you see here as the standard plan is the exact same plan as offered last year. What is new this year is the Premier plan. Let's take a look at the standard plan first. The standard plan has a $15 copay for your annual exam. It also provides those covered with a $150 allowance for contacts or glasses. The frames coverage is every 24 months, while the contacts is every 12 months. Any additional expenses greater than $150 would receive a 20% savings. In addition, there is a 15% savings on any corrective vision procedure. Now let's look at the Premier plan. The Premier plan is the exact same thing as the standard plan, with the exception that it offers both glasses and contacts, whereas a standard plan only offers one or the other. This is a great advantage for those of us who enjoy having both options for frames as well as contacts. This would be a credit for all parties covered, be your child, your spouse, or yourself. It is recommended that you see an in-network provider, if possible, as you will get the greatest savings. If you happen to see an out-of-network provider with this coverage, you would have to pay the cost up front and then submit to VSP a claim for reimbursement. Notice, though, that your reimbursement amount is less than an in-network provider coverage amount. For example, for frames, your out-of-network provider will give you $70, but in-network you get a credit of $150. Disability and life insurance. We are excited to announce our new life and disability insurance coverage carrier starting in 2018, MetLife, the same carrier as our dental coverage. Every employee receives a free basic life insurance policy provided to you by DriveTime. The basic life insurance coverage amount is equal to 1 time your annual earnings up to $50,000. This coverage is automatically given to you just for being an employee of DriveTime. You do not need to worry about electing basic life insurance. You automatically get it. However, you may want to increase your life coverage amount with additional coverage, known as supplemental coverage for yourself, your spouse, or your children. New this year, we are very excited to tell you that if you decide to elect an additional $100,000 of supplemental life insurance for yourself from last year's election, since we have a new carrier, you will not be subject to evidence of insurability, as long as the total amount is equal to the guarantee issue amount or less. That is a lot of information, we know. So let's talk about what this means. First, let's explain what evidence of insurability is. Evidence of insurability, also known as EOI, is an application process that evaluates your risk for coverage. Basically, it's an application that requires a bit of paperwork, including medical documentation, from you so that the insurance company can determine the level of risk to cover you with the additional life insurance. Which means that if you are subject to EOI, there is no guarantee that you will receive the coverage. It depends on your EOI results. Basically, there's a possibility that the coverage will be denied. Okay, so now we understand what EOI is. Let's talk about the guarantee issue amount. You can see that the supplemental life coverage maximum amount is up to 5 times your salary, or $450,000. This is the maximum amount that an employee can elect. The guarantee issue amount for employee-only supplemental coverage is $300,000. So as long as you are electing up to $100,000 more than the coverage you elected for 2017, and that amount does not exceed the guarantee issue amount of $300,000, you will not be subject to EOI. For example, if you did not elect supplemental coverage for yourself for 2017 enrollment, and you want to do that for 2018, you can elect up to $100,000 without being subject to EOI. As long as you maintain the same coverage elections from 2017 to 2018, you will not be subject to EOI. In addition to life insurance, employees may also elect short-term and long-term disability coverage. Disability coverage provides an employee the ability to be compensated in the event the employee is unable to work due to a disability for an extended continuous period of time. If you have to have surgery that will require recovery time, forcing you to be out of work for at least 2 months, you'll have to request a leave of absence to protect your job for your time off. Leave of absence will not provide you any compensation other than your own accrued PTO. If you want to earn a paycheck to cover your expenses during this time period, that is disability insurance. There are 2 types of disability insurance, short-term and long-term. Short-term will cover an employee for up to 11 weeks after a 2-week waiting period. The first 14 days, including weekend days, of the employee's disability are not paid. After the 2-week waiting period, short-term disability will pay out on a weekly basis at 60% of your regular wages. The 60% of wages is calculated from the Box 1 wages in your last year's W-2, if you worked for a full year the previous year. If you are a newer employee and did not work a full year the previous year, then the 60% of your wages will be based off of your base pay for the current year. Short-term disability and long-term disability is a package deal with the company. When you go through the enrollment process, you will only see long-term disability listed as an option. This is because if you elect long-term disability, you automatically get short-term disability. The company will pay for your short-term disability coverage when you elect the long-term. Normally, if you did not elect this coverage previously and decide to elect it at open enrollment, you would be subject to EOI. That great news we talked about a second ago applies to disability too. If you elected at open enrollment this October for 2018 coverage, you will not be subject to EOI. Voluntary benefits. New for 2018 are 3 different voluntary benefit options, also covered by MetLife. This is the first year the company has ever offered these types of insurance coverages. The voluntary benefits that the company is going to offer are critical illness, accident, and hospital indemnity insurance. These insurance options work like gap insurance or like AFLAC. They basically offer you an opportunity to receive some money to help pay for expenses due to a situation that qualifies under the type of insurance coverage you elected. For example, let's look at hospital indemnity insurance. Let's say you're admitted to the hospital for a number of days. Your medical insurance will cover you for a portion of your expenses. However, medical insurance will not cover everything. You will still have medical expenses to pay out of pocket. The hospital indemnity insurance would provide you a check based on your coverage amount that you can use towards those hospital expenses, child care, household bills, basically however you see fit. One additional advantage is a health screening benefit of $50 when you elect the critical illness and or the hospital indemnity insurance coverages. This means that you get a $50 once per year for attending a preventative care appointment, such as a dental cleaning, a wellness visit with your primary care physician. Keep in mind costs vary depending on the coverage amount you elect and who you want to cover, yourself, your spouse, and your child. When you go through the enrollment process, you'll be able to see the costs based on what you're electing.
Now we'll be going over the 401k retirement savings that offered here at DriveTime. Our 401k program is managed by Fidelity at www.401k.com. DriveTime matches 40 cents on every dollar for the first 6% of the salary you contribute. Also, a very great thing to note is that this is not only open during open enrollment. You can go in and do this at any time. Also, we work our 401k investments on a vesting schedule. What this means is you receive 20% of that employer match for each year that you work here. For example, your first year, you will have 20%. Your second year, you will get 40%. And this is all buried on if you choose to leave the company at that time. So remember, stay with us and you'll get your full 100% match as long as you've been with us for that 5 years. Now that we've gone over all of the benefit options that we were offering for 2018, let's talk about how we actually enroll in those. You will need to go to www.mydtbenefits.com and log in. Your login information is your employee ID, which is DT012345 or whatever number sequence is applied to you, and the last 4 of your social, 012345, or whatever your number sequence may be. That will be your password. Once you log in, on the right-hand side, you will see Manage My Benefits. You will hit Manage My Benefits, and you will see Available Transactions. 2018 Open Enrollment will be your only available transaction. You will hit Start Now. This will lead you to a screen which will actually show you all of the options that you have. Medical, the HSA that was talked about, or even an FSA. At this time, you will just you will begin with medical, and you'll see all of the options that you're able to choose, and you'll also see the options that you currently have chosen. There will be a 24-hour service support via email and a call center at 855-430-4558, We do recommend you reach out to them if you are having any sort of technical difficulty or you would like something better explained to you. Once you've made all of your elections, you will need to confirm those elections. You will have an option to print your confirmation so that you can actually save that for your files and reference back to it. Keep in mind, if you do not confirm your elections for this 2018 open enrollment, you will not receive those changes or additions that you have made. Thank you for taking the time to listen to our presentation. If you have any questions, please feel free to reach out to us at 888-781-5654, option 1, or 855-430-4558.